the Pima County Health Department presentation with Mark and Myra. We're glad to have you here and look forward to what you have to share with us today. And you're up next.
All right, thanks everybody. Hopefully you get my video up here. Again, just to formally introduce myself, I'm Mark Person. I'm a program manager for the Community Mental Health and Addictions Unit, which is just a program that sits within the health department. Myra is actually out on maternity leave, so she won't be here today. She's home with her little ones and enjoying life. But I just wanted to quick introduce sort of the purpose behind this, and then I don't have a formal like PowerPoint presentation. I have a dashboard that I'm gonna kind of filter through some of these trends and show you stuff that applies to the younger demographic. The purpose for this is simply to spread awareness and give people information that may help them stay safe out there. The primary goal of public health is always to work with the public and try to eliminate risks and give people valuable information about health trends in the community and what kind of things to stay away from and what kind of things to do to stay healthy, those kind of things. So that's really where this is coming from. But the team, just to give you a little bit of background, our team does a lot of things, but one of those is surveillance of specific health trends. So that means we look at data that's coming in on different age groups, different locations, and our team looks specifically at things that would normally be impacted or seen in communities with lower socioeconomic status, mental health, substance use, disabilities, any of those trends that may disproportionately impact people are things that we constantly look at. So you kind of can draw the comparison of taking somebody's vitals. You want to keep your finger on the pulse, and if you see something that's concerning, you act, you do something. So that's what we're doing with the data. If something goes up that we don't want to see go up, it means we do something about it. So this meeting and the information I'll present is us doing something about it. Now, that being said, it's most of what we'll talk about today is about the poor health outcomes that we've seen. It's a little bit grim, and the data tells the story itself, but I do want to talk about what we can do to stop it and things that we can work on and partner on to help get us out of these type of situations where things like substance use and addiction are really even more problematic today than they've ever been. So let me share my screen and let the data do the talking here. Let me know. Hopefully it'll come up here. Expand it. Can you guys see this okay? All right. So this is our data dashboard. It'll enable us, we can click back and forth between different years so you can compare the trends and see how they change. But this is all focused on drug overdose deaths. So every one of these statistics is associated with a fatal overdose. You'll see the full demographic on here of all age groups, but I'm coming to you today because of the trends that we've seen in the last 12 months or so related to minors and young adults. A lot of alarming things that really we need to act on and work with people like you that are in position to maybe do something about this, even if it's just telling one person or giving them information on where they can go to get resources or stay safe. That's what it's all about. If I sit here on this data and just look at it, it does nothing for anybody. So this top left graph here, I'll kind of try to direct your attention with the mouse. This is a picture of the last 7 years, so you can just sort of get the background behind this. So this is the total number of overdose deaths in Pima County. You can see back here in 2015, there was a total of 262. And then for the next couple of years here, it fluctuates between, the 260s and 280s, doesn't change a whole lot. But then you can see clearly in 2019 that it jumps from all of a sudden 286 to 337. Though the difference of that being, around 50 may not sound like a lot, but when we're talking about the jump from one year to the next, given the fluctuations in the past, it was at that time a pretty significant change. And what we found with that is that was really when the introduction of non-pharmaceutical fentanyl hit the streets, commonly referred to as like M30s or Mexican oxy or blue oxy. There's all kinds of different terminology, and I'll get into that stuff. But those drugs started to show up in the years before, but not in really high numbers. But by the time 2019 hit, it really took off, and the number of these lethal drugs in the community was just a lot more accessible, and started to impact people all over the place. And by the time we hit the next year, you can see by this time we've jumped by over 100 deaths from one year to the next. So these type of changes right here that you see have never before been seen in the history of Pima County. We've never had a year where we've had over 300 overdose deaths, and we've definitely never had a year where we've had more than 400. At this point in time in 2021, right now, through part of August, we've officially determined that there's been 310 fatal overdoses so far, and that puts us on pace to exceed 500. So just to kind of give you the overall picture of where we're at and how significant these trends are, it really is showing no signs of slowing down. Again, the primary cause is this right here. If we look at the top drugs that contribute to the majority of these overdoses, these 6 here are most commonly part of the picture, but you can see the full list on the right. But fentanyl really tells the story, and methamphetamines as well. But back in 2015, you can see fentanyl way down here at only 14 overdoses. And then it's sort of just trickling along in the teens for those years. But by the time we get to 2018, it goes up into the 40s and then into the 80s. And then last year we exceeded over 200. We've never seen a drug that has contributed to that many fatal overdoses in such a short period of time. Not even methamphetamines, which was our biggest issue over the last several years. Not even that drug has compared to where we're at with fentanyl. And you can see down here for perspective in gray is heroin, the drug that most people think about as being really the most lethal, the most problematic, really dangerous. You say the word heroin and everybody knows what you're talking about. And you can see that particular drug is nowhere near the numbers that we see with fentanyl and methamphetamine. So I just wanted to lay that out there so we kind of know what has led up to where we're at. There's lots of other things that factor in, but it's fentanyl that I want to talk about the most today, because those statistics are really troubling. And then down here, I won't talk in depth, but you can see month to month where we're at this year so far. And then you have the number of these overdoses that are either accidental, intentional, or undetermined. That question comes up a lot. How many of these are intentional overdoses versus accidental? The majority of all of these have been ruled an accidental overdose. And then here's just a better picture of all the different drugs. But let me show you how it changes from, if we start back at 2017, if you keep an eye on kind of meth and fentanyl and heroin here, you'll see how it changes over time. So just kind of keep your eye on those to look at how that changes from 17 to 21. I mean, it's pretty drastic. So that's just a picture about just the general trends. So now let's talk about what's, what I think is more applicable and specific to the work that you guys do in the age demographics. So this page is a continuation of those stats that we saw on the other page, but now we're looking at which age groups. We're looking at race and ethnicity. We're looking at assigned sex at birth and percentages, all of those things. So here's where I want to just take some time to kind of go over it and explain it. And then if you all have questions, please feel free to jump in, or if there's something you want me to talk about a little bit more in depth, I'll do that. But the age groups that I'll direct your attention to for this presentation, of course, look at all of them, but you'll see the way these colors are laid out. The key is at the bottom. So this is age groups 0 to 5, 6 to 12, 13 to 19, and so on. So that it goes from left to right, from youngest to oldest. And these color dots correspond with the bar graph up here, and also the percentages. These percentage dots, the bigger the dot, the higher percentage. So you can kind of see how that works. But the age groups that I think are most applicable would be these first four, and we'll take you through kind of historically how these have changed and what fentanyl has done to some of these statistics. So if we go back to 2018, and these three graphs here are all linked. So as I change, you'll see both of them change. This one is not. So there's a lot of data that goes into the race and ethnicity rates, so that it can't function with these two, but you'll see that just in case you have questions about it. But in 2018, you can see the youngest age groups here, the birth to 5, 6 to 12, teens, and people in their 20s. We had a pretty significant number of people in their 20s, 52 fatal overdoses that year. And then we had 8 teens that died of an overdose, and then fortunately 0 in these younger age groups. Now, these are really rare to see an overdose death, obviously, in these age groups, because anything that occurs with somebody in that age is typically a unintentional ingestion or a true accident, not something that somebody intended on doing. Be kind of the equivalent of a toddler getting into something hazardous under the kitchen sink or something like that. So let's keep our eye again on these 4 groups as I go forward. So fast forward now to 2019, when we saw those trends start to increase on the previous page, and you can see the percentages and the numbers change a little bit here with people in their 20s. Stayed the same right here, and then we did have one toddler that died by overdose in that particular year, but most of the change occurred here with people in their 20s, which is to be expected if we're talking about recreational drug use and addiction. The majority of those numbers are, there's a lot more people in their adult years that have developed a substance use disorder. So now, though, by the time we get to 2020, when those statistics really spike back there, you can see what happens. So I'll do that again just for effect so you can see it. But we're way down here. All the age groups go up, but look what happens to the people in their 20s and teens and below. You can see both of those. This one almost goes up to being the top age group most impacted by these drugs. And teens nearly doubled. So that number was 8 on the year before. It was 14 last year. And then we've got 1 individual between the ages of 6 and 12, and then 2 toddlers. So that's really a problem. We go from, a combination of there's 14, 15, 17 teens and minors in that year. And the year before, we only had 9, and the year before that, we had 8. So this is last year was when we first identified that, hey, there is a lot more young people being impacted by substance use in a very bad way, and it's different than what we've seen in the past. And the primary issue is fentanyl. It's not a mixture of a bunch of things. It's the presence of fentanyl and how lethal it is, how cheap it is, and how easy it is to get. And it's new. Not a whole lot of people know much about it. Not if you say fentanyl today, it's probably gaining a lot of understanding from people in the community, but it doesn't have the same effect as, say, cocaine or heroin. You say those words and just about anybody knows what you're talking about. But because fentanyl is new, there's not a whole lot of, community understanding of it and how risky it is and those things. So I definitely wanted to talk about that. But here, let's fast forward now to the present, where we're at right now, and continue to look at those numbers, but realize that these numbers are only going to be a partial year. So we're looking at a complete 12 months here. This is going to be just through August. So we got 4 months left on the year. So you'll see them go down. But nonetheless, look at the numbers. We're already at 19 fatal overdoses in 2021 in those first 3 age groups, compared to the 17 we had for the complete year last year, and only 9 in the complete year in 2019. So we've already doubled what we've seen in previous years. And what I'll tell you about this age group specifically, the teens, is the unique thing about it is if you look at the drugs in all these other age groups, you'd see a mixture of cocaine, alcohol, methamphetamines, heroin, prescription drugs. You'd see all kinds of different things in there. With these 17 fatalities that we've had so far, every one of them is from fentanyl. And that's totally unique to just this age group. A lot of the other age groups have been impacted by that drug, but not in that way, where every single one of them was caused by that one specific drug. That's a really unusual statistic, even though the number is small. It's really troubling for us locally. And so this is the last page that I'll show you here. And it has some of those highlights that I talked about. 100% of the accidental overdose deaths in the ages 13 to 19 were caused by fentanyl. And then this graph is just specific to teens. So it shows you where we've gone for the last few years, how it increased in 2020. And this is what we're projecting for 2021. And that's just based on the averages per month, based on what we've seen so far. So this would also be a historical high in Pima County for this age group, and especially for fentanyl specifically. So it's a really troubling statistic. This one is a similar graph for people in their 20s. So again, if we're looking at young adult populations, you can see again what's happened here, and they've been impacted even worse. The numbers are in the hundreds, and really some significant changes. But one potential positive here is that it does look like this year it may go down based on what we've seen so far. So a little bit of encouraging statistics there. But I'm going to stop there because the data is important and it tells the story kind of, but it really doesn't. It stops there. I really want to talk to you guys about what factors that are at play and why this stuff is happening and how it's different. We're in complete desperation to get this message to as many people as we can. I have 2 kids in school. Lots of people here do as well. I'm very passionate about this topic. My entire background and history is in the behavioral health system. That's all I've ever done. And it's all been in Tucson. I've been here for over 20 years, and I've never seen these statistics at this level. Fentanyl, the introduction of fentanyl is partially to blame, but we're also in such a unique environment right now. Stress levels are high across the board from the pandemic. Last year, lots of people went through stressors as a family with school closures, or maybe struggling financially, or with evictions, homeless rates, all of those things that we know impact somebody's mental health and substance use in a negative way. Poverty and access to resources has been something that we've known in this field, and you guys definitely full well know. It is closely connected to individuals who turn to either drugs and alcohol to relieve pain, or develop behavioral health crisis situations. All those things are impacted by this stuff. So there's no doubt that environmentally there's some influence at play there. But the role of fentanyl can't be ignored. That's by far and away the number one risk. And what I want to tell people about this is, like, I think back when I was a kid, I've had my fair share of issues and struggles. Certainly when I was a younger person, I had lots of issues with drugs and alcohol, and plenty of mental health concerns of my own. And I can tell you the things that I remember as a kid, the Scared Straight programs and Just Say No and all these things that we knew from the 80s and 90s. And, those messages were, important, but really never absorbed by people. And I think everyone kind of looked at it as whatever. It's just more adults kind of trying to mess with my life and tell me stuff I already know. But today, that message is a lot different. These drugs, particularly fentanyl, are the most dangerous substances on the planet right now. There's not any other drug that's more potent and more lethal than fentanyl. And for a lot of reasons, it's led to really high numbers of overdose deaths across the nation, not just Pima County, but it's a deceptive drug. It looks relatively safe when you see it. It looks just like a pill you'd get from the pharmacy. And what happened over time is everybody got used to things like Percocet and oxycodone and hydrocodone, things you got from the pharmacy. Looked relatively safe. And a lot of those wound up in the hands of kids and adults who were taking them for recreational purposes instead of for pain. These pills look just like that. And the unfortunate reality is the contents of these pills are completely unpredictable. There is one pill could contain enough to kill 5 people, or the next pill could contain nothing. So how they're produced is totally unpredictable. And you have that paired with a drug that is so potent that it only takes about the size of a grain of salt is enough to kill a adult human. There's no shortage of ways to describe how severe this is, but I like to tell a story that we got from our fatality reviews, which is a process where we actually read all the evidence and go through step by step what led up to someone's death. And we had a case not too long ago where there was a party and people had fentanyl in the form of pills, and 4 people took one small little round pill, broke it into 4 pieces and shared it. And so you're talking about a tiny little chunk of a pill you'd get from the pharmacy, and 3 people experienced no effect at all from that drug, and the 4th person died. And that, I think, really highlights the risk. There's no way to understand what is in these pills when you take them. Like I say, it could be nothing, or just a little bit, or way too much. But that's why that it's so deceptive, and why it's catching a lot of people kind of off guard. Historically, you could take a pill and break it in half and say, okay, by breaking it in half, I've just kind of removed half of the power of this drug. It's going to be half as potent as it was if I would have taken the whole thing. You can't do that with fentanyl because the contents of it are not, mixed within the pill equally, and it's impossible to know what's in it. And so even people with really experienced history of using drugs, that have been using drugs for long periods of time, are dying right away from this drug, because it's totally different. You can't look at a physical amount and decide how much to take. And it's really difficult for emergency services to get there in time to reverse some of these or treat these overdoses because of how quickly it happens. a lot of these cases, by the time the person ingests the pill, whether they swallow it or smoke it, they've been pushed into respiratory crisis and in a state of a medical emergency in a matter of 15 minutes. And if nobody's around with them, then we're in real trouble. And that's the majority of these happen inside a house, where someone is either by themselves or the next day, other people in the house don't discover what happened until the next morning. And for that reason, it's really hard for us to come up with harm reduction messaging. I don't know how familiar everybody is with that, but for the longest time, you'd work with people that have issues with substance use or addiction, regardless of the drug, and you work on harm reduction. You work on ways to say, hey, let's at least, it's not realistic to think you're just going to stop. And we're not going to get after you if you continue to use. We want to move forward with progress. So we want to reduce your use over time, where, hey, let's only maybe use half of what you usually do, or make sure you have somebody with you in case something happens, have a plan, all of those things. That's really our best plan to work with people to get them into treatment and keep them alive. But with fentanyl at the table, we still continue to say those things, but they're just not effective anymore. I can't tell somebody to, well, I can tell them, at least if you're going to take a drug like that, break it in half. But there's still very little hope that doing that is going to reduce the likelihood of an overdose. It's better than doing nothing, but that message is just not effective for us anymore, just because of how potent it is. And a lot of people don't know what they're taking as well. So unfortunately, kids are, young, experimental, not really as aware of some of the risks. And I know that because I was a kid and did a lot of the same things. So I'm not just saying that based on judgment. I know what it's like to be a kid, but I don't know what it's like to be a kid in today's environment. There's just a lot going on. So I guess my call to everybody listening is, if you work with kids or young adults, or even if you think that a family or a person or a group that you work with doesn't have issues with substances, this topic is critical for everybody to talk about everywhere you go. If I'm in a business meeting here at the county and people are talking about, how much paper we should purchase this year or something completely off topic, I stop everybody to talk about this data regardless. And I'm just trying to just jam it down everyone's throat so that everywhere I go, I talk about this, because to me, the knowledge is the best thing that we can give you. And the message really is, anything that you get on the streets that doesn't come directly from a pharmacy, any of it could contain fentanyl, and it could contain a lethal dose. And it doesn't matter if you think what you've got is oxycodone, or if you think you purchased heroin, or you think you purchased cocaine. I hear that a lot. Well, I don't ever use heroin or fentanyl. I don't like that stuff. I only use, I smoke powder. I only use, methamphetamines or cocaine or something like that. All these drugs have been mixed with one another too, so you have to be conscious of that. But really, kids are the most important demographic we've got, and it's a huge priority for us in public health. And every time I read one of these cases, it has the same effect on me, and I really need to get this message out there. So I really appreciate the time. I probably have already gone over my 20 or 30 minutes, but I'll leave it to you all. If there is time, I'm happy to stay on and navigate some discussion or answer questions. So I'll keep this data up and just pause here.
Thank you, Mark, for that powerful information, and also for sharing your story. I appreciate the work that you do sincerely, and also thank you for encouraging us to share that information and data, and just encouraging us to share that stuff, and to take initiative in prevention and seeking conversation and truth about this information that you've shared with us and how our community is being affected. I really appreciate having you today.
Absolutely. I appreciate you saying that, Mercedes. This is what it's all about. And thank you for giving me the time to talk, and happy to share return for any other meetings that you guys think this stuff would help.
I have a question, Mark.
Yeah.
I know that y'all have Narcan and stuff that you distribute. Do you distribute fentanyl test kits?
We will, yeah. So you probably saw in the news that the state not too long ago legalized the use of fentanyl test strips. So that gave us the ability to start purchasing it. So I do have plans to purchase about 50,000 fentanyl test strips is the goal. We can't buy them yet, but once the funds become available, we'll have them and we'll begin distributing that just like we do Narcan. And for anybody that's not up in the know on fentanyl test strips, it's basically real similar to the test strips that you dip in a spa or a pool and they turn colors to kind of tell you what chemicals are in there. It operates the same way. It's actually really similar to a pregnancy test as well. But it allows the person to test the drugs that they've got to see if they contain fentanyl. And then hopefully if they determine that they do, they make a safe choice to discard it or not take it, or be really careful about what they do with it. So that's how those are used. They're pretty cheap and they'll be available for free from us.
Mark,
Hi.
I have a question on the fentanyl test kits. How can an organization request those kits from Pima County?
Yeah, so we have, I'll put this in the chat if there's time, or I'll give it to Austin as well. We have a referral inbox that goes directly to the health department. It goes to my team actually. So when people request Narcan, there's a form they fill out, send it through to us, and then we process it and give it and take it from there. And we'll work with the agency to either deliver it or have them come pick it up from the health department office here. So I'll give you guys that email and the form that goes with it.
Thank you.
Mark, this is Sylvia from the Department of Education. How does Pima County Health Department work with school districts, or is there anything in place for this particular situation? Any upcoming advertisements or information sessions?
Great question. Yeah. I've worked with several of the districts and done some presentations like this, but of course, last year we didn't. That's been part of the issue, is getting access to kids is really difficult because of the virtual platforms that most were used to for a long period of time. But I've done these presentations for the teachers and administrators and superintendents throughout Pima County. But it really needs to go directly to the kids. And so that's really what we're going to be working on. But I did do a couple of these with the group of superintendents in the charter schools. We also send out health alerts far and wide. They don't go directly to all the schools, but if they happen to be on our distribution list, we'll pick them up. But if you think about this as kind of advertisement, we're competing with COVID-19, and it's hard to break through that headline when it's pretty much everything that anybody's thought about or read about or talked about for the last year. That's part of the issue, really, is socially, just everything has been dominated by that disease, and it's distracted people, and it's redirected resources to other priorities. So that's our goal for this year, is to get back to doing that stuff, getting out on the grounds and talking in front of people and getting those important messages through. So with that being said, we do have another a curriculum, really. It's called Strengthening Families, and we have health educators that that do work directly with families and kids on not specific to this data. It's more about substance use and mental health in general, and how to talk as a family openly about that stuff without judgment and penalty, and work together and keep each other safe. That's kind of what the purpose of that is. So we do have that program, and that's offered specifically to families with school age kids. So that's up and running too. But yeah, a lot more work that needs to be done with the schools for sure.
Mark, I had a couple questions for you. This is Leah Duncan.
Sure.
I wondered if there's any kind of literature that you have that I could have available if youth come into libraries, which they're coming in a little bit more than they have been since we've been opening up a little bit. But if there's any kind of like handouts or something that would address this a little bit, I hear what you say about sharing the information, but I can't like snag every person I see and be like, hey, by the way, you're a
Yeah,
youth, and but it would be great if there was something, and also maybe to sign up for those health alerts. Like if you guys know there's something bad circulating around, that would be a great thing to be able to do as well.
sure. Yeah, absolutely. And we post them all on our website too. So you could even go back at any time you wanted to see, what the updates are, or historically what we've sent out. So I'll send that as well for you guys. And it doesn't
Okay.
have to populate your inbox. If you're like me, it takes all day to read the emails. But yeah, we have infographics and pamphlets and social media posts, all kinds of stuff that has information like that I'd be more than happy to get out to you guys. So I'll make note of all this stuff and kind of send a package of all those links.
Yeah, that would be great. I'd appreciate it. I also have like questions like why May? Why is May such a hard month? And why is like 70 to 75% male? What's going on?
Oh yeah, those are so.
May's when school gets out. You're like,
So
celebrating.
Yeah, I guess. Huh?
This one
Exactly.
Yeah, I mean, part of these fluctuations you do have to think about. It's kind of the same. It's the same thing with COVID. We look at this that way too, with the cases going up and down and those kind of things. Pima County has a big student population that comes and goes, and we have a huge snowbird population. We don't ever really know the exact number, but it's estimated to be over 100,000 people. And so, in the spring, late spring, when everybody returns and, the traffic is horrible, we all see it and feel it. And in the fall, so there are those fluctuations, but you would expect maybe May to be like that, maybe June, July, but these particular months, the trends are more consistent with the amount of drugs in the community than they are anything else. So if I were to show you the same graph here with these months, and I were to show you the number or weight of all the drugs that have been seized from month to month, you'll see fluctuations like that too. In the months where we have high numbers of seizures locally here, that corresponds with the number of overdose deaths too. So it's about accessibility. The drug market, you can't really accurately measure it, but it's just like any other product. If it gets mass production and it's cheap and easy to get, you're going to have periods of time where consumption is really, really high versus maybe it kind of filters away. So these type of events are connected to the accessibility of these drugs more than anything else. But the stress levels and things like that also are a part of it. But the percentage of males that you saw here at 73%, if you do a little research and look up just about any statistic, whether it's car accidents, firearm deaths, overdoses, suicides, heart attacks, this percentage is repeatable with just about any other injury. Just men are much more likely to die of an accident like this. That's why insurance companies don't want to cover us. And this statistic has been well known for a long time, and it plays out here as well. And it's not necessarily specific to someone's assigned sex at birth. It's more to do with the personality of the person and how they identify. Is this somebody that's adventurous? And, if you think about just traditionally in general, your stereotypical teenage boy, speeding and reckless behavior and showing off. We do a lot of stuff differently. And that's where it really is a little bit more consistent. I wish we had statistics that would be a little bit more inclusive of all populations, because to me, it really has nothing to do with the actual sex of the person. It has to do with who they are at their core and how they behave and how they act. It's more of the sort of that macho approach. That's the kind of thing that gets us into trouble and why we're more prone to accidents. If I'm home talking to my family about it, I always just say it's just because I was a lot dumber when I was a kid than my sisters were. But that's the kind of the breakdown of that and how I explain it. The really unfortunate reality, though, with that statistic is death certificates go by the old way of just counting male and female, and there's no other data that we can pull to look that would be inclusive of the LGBTQ community. We even have a hard time finding statistics for veterans, just because it's not in there. It's that really old way of doing things that's exclusionary of lots of other populations, and so it's difficult to measure it. But so that you have to kind of keep that in mind too, that this is really just looking at that old way, scientific kind of way of measuring things. I don't like doing it this way, but it's all we've got. But that is the statistic you'll see in any other graph, especially if it has to do with an accident or an unintended injury.
And Mark, you have a question in the chat about sharing the data that you've shown here.
Oh yeah, sorry, I've got the screen minimized. I didn't see the chat. Yeah, I can. That link that I'll give you on our page will have all of these statistics on there. The dashboard itself and how it functions, I don't have available to send out publicly, but I can give you the data and the snapshots of this so that you can reference those things too. Any other feedback, or I'm always looking for help and guidance on ways to present this stuff, and whether it's the visual presentation or the data or the discussion that follows, anything that you guys would say that stands out that I could emphasize more, focus on more, or things I could cut out. I have thick skin, so this is all about us getting better. So feel free to fire away.
Well, it's all awful. No, I'm just kidding. It's a really cool presentation. I really am glad that I'm part of this, because I would have never been informed on these statistics otherwise if I wasn't here. That's pretty cool. It's astonishing to see how the numbers kind of stay almost steady and continuous as the age goes after that kind of youth, kind of like the teenage years. There's a huge incline and it's almost steady and steadily declines. That's what I find super interesting. And do you know why that's that way?
It was a lot easier to explain it 2 years ago, but because fentanyl has hit the picture, so there are specific drugs that are more attractive to specific age groups. You don't see a lot of young people using heroin. It happens, yeah, but the majority of the people that use heroin are adults and a lot more likely to be in their 40s and 50s. And the same can be said for methamphetamines. That's a little bit less common for young people to use right now. So there's kind of that, it's almost kind of like a sort of horrible example, but almost like a fashion trend, right? It applies to or specific age groups. And fentanyl is really hitting the younger age groups more so because of how cheap it is and how easy it is to get and how easy it is to hide. That's a really big thing. You know, you don't have to, it's not in a big, baggie. It doesn't have a scent. If you don't want to use most people aren't shooting it up. You don't have to have needles and paraphernalia. It's just a tiny little pill. You could have 50 of them in, your left pocket and not even notice. So you can hide it and conceal it anywhere. And that's why it's so easy to get. The pills are, $5-10 a piece, and people know how potent they are. So it's about which age demographics are impacted by these drugs in different ways, but then it fluctuates, like 2-3 years ago, is more of a methamphetamines was the big issue. And, or heroin has always been kind of near the top, but when those things change, it affects the age groups a little bit. But you also have to consider the size of the population. Like there's adults over the age of 20, are numerous. There's not as many teens and school age youth. So the numbers are a little bit different, but otherwise though, when you see like big changes, it's hard to put your finger on exactly why, because it doesn't always make sense. And the other reality behind this is suicides are a very, very close comparison. The people that are impacted by substance use are also impacted by suicide, and the risk factors and the stressors, the trauma, all those things are strikingly similar. So years where we have more suicides, sometimes that may play out to be a small reduction in overdoses or vice versa. But part of this is we have a fair number of overdose deaths that potentially may have been a suicide, but there's no way to rule it. So that number could be underreported. And when that happens, then you'll see it listed here on the overdose side as undetermined or sometimes accidental, just because we don't know. So that kind of murkies the water a little bit too. But there's a few different things that come to mind, but last year and this year are completely unique. You have to look at what happened in our environment, and for any human being, you put them under large amounts of stress that they're not used to for long periods of time, and reduce access to support and services, and a frightening environment. That people turn to anything for comfort. And all of us are the same. Our brains and our bodies react the same way. If you're fortunate enough to live with a supportive family and have resources and money, you're a little bit more resilient automatically. It doesn't mean you're immune to this, but it's a lot quicker to get to that period of hopelessness. If going into the pandemic, you were a family of 5 that paycheck to paycheck and already battling maybe mental illness and trying to balance your kids in school and work and daycare. And then all of a sudden the whole environment gets turned upside down. That family gets put into an immediate sense of crisis versus another family that's a little bit more fortunate. So that definitely is a huge factor here. It's impossible to measure that, but 2020 all of these statistics are going to be really unique to that year. So you have to kind of keep that in mind too.
And you have a comment in the chat. It
Okay.
says, I think all the information needs to stay in. It's all very important and needs to be viewed so that you can really see the impact of a substance issue in the community.
Okay, great. Yeah, that was kind of what I was fearing. I didn't want to spend a whole lot of time about the other stuff. I want to speak to, you know, things that are really relevant to you guys and the age groups that you work with or represent. So, but I'm glad to hear that. Yeah, you have to kind of apply some kind of background for this stuff. So I'm glad that seemed to come across well.
I don't see any other questions in the chat.
Okay, let me go ahead and stop sharing my screen, and then Austin, I'll stick around if you guys have questions or whatever, but I'll go ahead and mute myself and just gonna move on to your agenda.
Thank you again, Mark. Okay, now it's time for collaboration corner. It's 4:09, and Austin, not really sure if we usually go into groups or if we just kind of like do it from here, or if it depends on the agenda.
So it really is normally just like an open discussion if anyone had anything that they wanted to problem solve as a group. Any young people that y'all were trying to connect to particular resources that someone may have in here, like challenges. I see Lindsay has her hand raised.
I do. So I have a couple of things from the DCS side. So we have the CA funds that we are working with right now as we get ready to wrap up what some of that COVID funding looks like. So I'm going to pop a link in the chat for us, but as of October 1st, youth 21 and older will no longer be eligible. We're going to focus with youth that are in care, ages 14 and older. They could be in out-of-home care, they could be in group homes, whatever that might be, but youth that are still in care with us. And then currently we are managing funds through a portal that's specific to DCS, but then we are working with AFF-CF to help navigate some of that on the back end. And then there are, of course, still the guidelines and limits that surround that. So we're looking at that $2,000, the guidelines there. And so I have a couple links I'll share with you. One of them is the funding criteria, and the other one is a link that you can share with any youth that you know that might not have access to those CAA funds yet that might be eligible for them.
Thanks, Lindsay.
Lindsay, that was for funds that were for youth that were in the foster care system.
Yes, so they
or
are
that
the
had
CAA
left the
funds.
foster care system. Okay.
So currently we are able to fund, let me pull up my cheat sheet here. I had it open here. So we had been able to fund youth that were 21 years of age and older that were in care back when this COVID adventure first started happening a while back. So now we are making that change as of October 1st to limit ages 21 and older, and then go back to the primary focus of youth 14 and older up to that 21 timeframe.
I recently found out last night actually that there is one person that from AFF-CF that actually works in Pima County and does stuff like coordinate the scholarship program, as well as like connecting youth in Pima County to different resources, because like AFF-CF is mostly in Maricopa County. Her name's Lynn LeClaire, and I'll drop her info in the chat.
Thank you, Victoria. So just for clarity, youth older than 21 can still apply to the CA grant until October.
And I am gonna pop a link in that has the information to fill out, and then also Eva's contact information. So if you're not sure if somebody would be eligible, she can verify eligibility.
Okay, thank you.
I think I got like a tiny update, and cat with a C might hop in. The city of Tucson got some funds from the Department of Economic Security through Emergency Solutions to provide landlord incentives to folks that are that are taking referrals through coordinated entry. And so I'm in the process now of doing some grant amendments for some of our providers that are serving YHDP programs. And so, and Kat, Paulson, if you'd like, you can speak like specifically to what that would include, but it provides some additional move-in assistance for folks that I think is really, really awesome and helps to secure units when it's kind of challenging in this environment. And so it can pay up to 6 months of utility or rental arrears. So if somebody, was behind for about 6 months in paying rent or electric, this incentive would be able to support that. If they needed a deposit to turn on utilities, it can support that. It can also do up to 1.5 times of a deposit to kind of like secure placement for someone that may have like adverse rental history or something that's preventing them. And so the agencies that will be accessing that incentive will be Community Bridges, Our Family Services, Primavera, Compass Affordable Housing, and Salvation Army. So if y'all are accepting folks into your programs and you're one of those agencies, and you need a little training and you haven't connected with Kat Colston yet on that, circle back around.
So I don't have an update, but just a thought that maybe for all the places and folks who are going to access those strips from the health department that can detect like fentanyl. Say like if I was in high school and the counselor gave a presentation about, oh, we have this like in a prevention class that they might have, but I was like, not trying to be vulnerable in that space because I didn't want people to know the things that I do away from my academic life. Maybe we can have a list of places that those strips may be available so that there could be more discretion for people who just want to find that different space. Even if they weren't a part of the program that offered, like say like if Metro had strips available and there was somebody from an outside program or school that wanted to access strips, so that they located the name Metro Rec on a list of places that had those strips in the community, they wouldn't have to be a part of the program to come in and ask for something like that. Like maybe there could be a list of places that, and so that was just a thought, if that makes sense.
Kind of like a resource list of like non-judgmental safe places that you could get access any sorts of resources, any kind of resources that you might need.
Yeah, yeah.
Yeah, I definitely think that would be a good thing to have, like, maybe Yodo in the same way, maybe they could do that, maybe libraries could do that, something like that would be great.
So I don't know, Mark, I don't know if y'all keep track of the people who um I'm sure you collect some kind of data, or if that would be even be appropriate to release a list like that. But maybe it could be a voluntary list. Like some places want to be known as a safe place for pickup of strips, and some places don't want to. I don't know how possible that is. I'll probably mention it again.
Yeah, no, that's a great question. Yeah, so the health department is working on a plan to make several of our outpatient clinics a safe place for not just the fentanyl test strips, but Narcan and referrals for substance use services and needle exchange. We do have a couple of sites that already do the needle exchange, and we'll definitely have fentanyl test strips at those locations, and those are definitely no questions asked. It's not there's judgment free, and the whole goal is harm reduction and promoting safety for anybody that needs it. So those we will have, once we were able to purchase the test strips, those will be up and running, but it'll be a little while before we've got that at least to the point where we can promote it and tell people that we're ready to go. But you can get Narcan at any of those locations right now. If anybody needs that, the health department will distribute that for free. It's the nasal spray. Any of our Pima County clinics or libraries have them also, so you can get it there. And real quick, I did pop a couple of links into the chat there, you can see. So if you just navigate a little bit around, our website contains everything that you guys had asked about. If you just hover over that health button on the blue ribbon at the top and go to mental health, that'll bring you to all of our stuff. So you'll see the data and reports icon. You'll see something for naloxone and presentations and stuff like that on there. You can click on any of those and kind of find a lot of the information we were talking about. And then our email address and contact information is up on the top right there too. So yeah, let me know if there's any questions, but I think that you should be able to get everything you need from this site.
Okay, thank you, Mark. Because I know that I'm working part-time at the Goodwill Youth Program. I've kind of I know that staff has had some trainings on Narcan and naloxone, and I've seen some outreach workers that I walk with every week give out kits for prevention. And I'm still learning about I know training is necessary to be able to get to know the programs that are offering those things, but also really really important when you're to have the knowledge from when you're handing these kits to homeless youth. And I've been in playing detective on if like if there's trainings for youth, yes, which I've learned of one, but also if it's appropriate to give out prevention kits like that at youth programs that aren't say like health department or outpatient programs. And so I'm still like in the midst of learning, but I'll peep out the website that you offered and think about that list a little bit, and what other programs and could potentially be helpful or, you know, capable of offering the same safe space, even if they aren't specifically working only with prevention. And so I'm gonna learn a little bit more about that and dig around that website. Thank you.
Yeah, of course, no problem.
I wanted to come to HYC to talk about how the Supreme Court has blocked the CDC's, I don't know how to pronounce the word, but moratorium, I think, on evictions. And I wanted to kind of like talk with Homeless Youth Coalition of like, what are either ideas or things said that TPCH can do to like kind of like help with whatever effects happen from that blocking. And I know like recently City of Tucson got the Section 8 vouchers, so that's like the way we're working on that. But I'm wondering what else can like TPCH as a whole do in addressing that.
So the City of Tucson has like a whole eviction prevention website that has been open. I don't necessarily know that's super duper utilized, but I want to say Jason might have sent that back out, but I'll comb through. But there are like a considerable amount of eviction prevention funds that folks can access in the community. And, I think probably TPCH making sure to advertise that in the community so that folks know it exists. I don't know how many folks in this space know that portal, exists and that you can click it and navigate that. We had the emergency housing vouchers that our community got 102. It's 200. And Kat had to hop off, but I know that they are, working through making sure that I want to say the city has already fully placed those additional vouchers, so separate from the regular Section 8 vouchers. And there are a few agencies that are still working through some of those. Yeah, so that's what I know that's currently going on, and I will look for the link right now.
If I may as well, there's also CIC for people who are for eviction prevention. The CIC has funds that the landlord and the tenant can both complete. And I'll put their website in the chat as well.
Cool. I'm wondering if we could like have some sort of like one page or kind of like talking about these two specific programs so that that could be handed out at different sites so people know and they can like reach out to more people.
The eviction prevention stuff on the city side, I want to say they have a whole like package of things that they set up. So I will dig that out too. And I just put the link in the chat. Let's see here. Let me switch my shares. Y'all got 3 minutes left in your meeting, so I don't want to be like rude, but also this is important. So that site that I just put in the chat looks like this. It talks about like important dates. It tells you more about that actual what was released. It gives you a link to apply and where to call. And then it lets you know there's a dashboard here. Let's see, it was last updated a couple days ago. That lets you know who has been supported and where they are currently in that process. Thank you, Mark. Yeah, and then here's some information on like the steps for that, and then some frequently asked questions. And those are participating agencies that are